Welcome to our video presentation on educational games, which is what we based our database on. This video is created by Mariah Baldwin, Tanya England, and Jennifer Mathis. Now, let's begin first with the definition and the background of our trend. What are educational games? Educational games are tools and resources designed to teach players specific skills or knowledge while participating in engaging and fun interactive activities. Games strive to help with hands-on learning, which provides students with the opportunity to be interactive and active in the classroom. It also helps increase engagement and participation and motivate students and provide a willingness to increase this engagement in their learning. It provides social emotional development for students to engage and develop more social skills, and it helps provoke critical thinking and skill development and problem solving. Additional research reveals a long history of popularizing educational games in the classroom, in which the first computer game was invented in the 1960s. Details shows that games can also offer diverse settings and differentiated instruction for various learners, multiple grade levels, and content. Data analyzes cognitive learning skills and shows a huge academic performance improvement that students are able to think strategically and make effective decisions. There's a development of social skills, interaction, and involvement that helps create an overall transformative educational experience, and games provide a collaborative approach where learners and instructors seem to benefit from the instructional strategies and resources. Here are just a few examples of some of the educational games that we discovered. These background details and examples of this trend are just some of the tools and skills that support our trend. In our video, you will learn more about our research and discovery of educational games used particularly in the K-12 and healthcare settings. We will start with addressing the K-12 subgroup and addressing the potential challenges and constraints first. In our K-12 secondary subgroup, we chose secondary education, which deals with 6th through 12th grade students. And typically, these students have a challenge with using educational games for leisure instead of learning, and this can create ineffective learning and academic discrepancies. They also have a difficult time in avoiding and eliminating distractions, and there's also more extended screen time and health concerns and challenges behind their usage of media and technology use. Lastly, there's a limitation of cognitive skills in which educational games are showing that there's a dependency on games to achieve mastery instead of honing on their own skills in the classroom. With addressing these challenges, we would evaluate our own teaching strategies and methods. We would use supervisory settings to closely monitor our students actively and consistently. We would also reinforce learning objectives and implement games that are of quality, academic, age-appropriate, and align clearly with the standards. In the healthcare setting, we take a look at the pharmacy education subgroup. The data shows that there are challenges and the drawbacks of having accessibility to updated healthcare information in the games. There could be a lack of research and evidence in healthcare data that's sufficient and evident, and there could also be an extremely high cost in creating games, which can result into poorly designed games and low quality games that can interfere with student success in healthcare. To address the restraints that educational games can have in healthcare, we would implement more consistent training, promote professional development, and continuous research to detect any issues early on in healthcare. We would continue knowledge and updated trends and issues and policies in healthcare, and ensure full evaluations of the planning process and design development before full implementation.
Planning and preparation for game-based learning in the K-12 setting. Educational games strategically integrated into school curriculum will foster a deeper understanding, student engagement will increase, and will improve content mastery by reinforcing key concepts and skills. Students will develop critical thinking and problem-solving skills through challenging activities which require them to think strategically and creatively. Planning and preparation for game-based learning. Before implementation, staff will be surveyed to identify where games could be most beneficial. A committee will analyze existing curriculum, identify learning objectives that align with game-based learning, evaluate the current technology infrastructure, and identify necessary upgrades. Educational games will be chosen based on the following criteria: curriculum alignment, age appropriateness, educational value, and accessibility. A library of games will be curated and categorized by subject, grade level, and learning objective. Teachers will receive professional development about incorporating games in lesson plans, games for assessment, and troubleshooting common technical issues. All students will need access to devices and internet connectivity. Implementation goals. Educational games are learning tools used to introduce concepts, reinforce knowledge, provide practice opportunities, and assess. Game choices will be offered to meet a diversity of abilities, interests, and learning styles, where difficulty and pacing can be modified. Multiplayer experiences will be included to promote teamwork, communication, and social skills. Game data will provide students with constructive feedback, track progress, identify areas for improvement, and supplement traditional assessments. The benefits of educational games and home resources will be shared with parents. Evaluation and refinement. Student engagement data, academic performance, and stakeholder feedback will be collected, which will be used to evaluate effectiveness and identify areas for improvement. To stay current, ongoing training and updates to the game library will be necessary. Key considerations for implementation. Educational games should supplement, not replace, traditional teaching methods. Games should be played purposefully and with clear learning objectives in mind. Teachers will play a crucial role in guiding and supporting game-based learning and teaching digital citizenship. All students, including those with disabilities, should have access. Planning and preparation for game-based learning in the healthcare setting. Gamification in healthcare is a powerful tool for improving learning and performance by adding motivational and interactive elements to training and daily tasks. Planning and preparation for game-based learning in the healthcare setting. To implement game-based learning, define clear goals. For example, improving clinical decisions, and assess gaps in knowledge or skills. Design experiences around these needs, including elements like levels, challenges, and rewards. Platforms may include mobile apps, web portals, or VR simulations. For example, a VR game for surgical residents to practice laparoscopic skills with performance scoring. Staff training on how and when to use the games should be a priority. Implementation goals. Game mechanics such as points, badges, leaderboards, and progress bars boost participation and intrinsic motivation by making learning more engaging and rewarding. This encourages repetition, which reinforces skills and knowledge. For example, nurses may earn points for completing infection control modules, unlocking new case scenarios. Game-based learning also improves knowledge retention. Interactive methods and repetition are more effective than passive lectures. Gamified platforms offer immediate feedback, helping learners correct mistakes in a low-risk environment. A mobile app, for instance, might quiz clinicians on sepsis protocols with instant explanations. Effective gamification must support learning outcomes and be clinically accurate, evidence-based, and user-centered. Evaluation and refinement. Staff engagement data, game-based learning performance will be collected, which will be used to evaluate effectiveness and identify areas for improvement. Integrate performance tracking and integrated performance tracking in healthcare game-based learning can significantly enhance the educational experience by providing valuable insights into learners' progress and areas for improvement. The program will be continuously refined based on user feedback. Key considerations for implementation. Balance is key. Too much gamification may feel unprofessional. Too little may fail to engage. Use both intrinsic motivators such as mastery, purpose, and an extrinsic reward such as badges and scores. Ensure accessibility for all employees. Consider the learner's role, experience level, and tech access. Gamification should complement, not replace, existing systems. Encourage teamwork over competition, and use features like leaderboards carefully to maintain motivation for all users. When choosing games for the healthcare setting, it is important to be mindful. Avoid overly gamey or insensitive content. Design for diversity, inclusivity, and data security.
Anyone exploring the use of educational games in a learning setting need to keep the following key details in mind. First, effective implementation of educational games requires strategic planning. Secondly, educational games must supplement, not replace, traditional instruction. Third, teachers must maintain balance and focus while preventing misuse or over-reliance on games. And lastly, the trend supports meaningful learning outcomes and a rigorous yet fun learning environment. When integrated properly, educational games can offer the following key benefits. They can help with content retention, critical thinking, and problem solving. They can adapt to learners' needs, support personalized learning, and enhance motivation and persistence. In addition, K-5 educational games can include social-emotional skill practice in addition to the academics. And in the K-12 educational setting, games can focus primarily on academics themselves. While games are often associated with entertainment or education, they're now transforming the healthcare field. Today, games are being integrated as a powerful tool for both medical training and patient treatment. For healthcare professionals, games offer realistic simulations that help surgeons practice robotic procedures in complex scenarios, providing an immersive experience beyond what cadavers and dummies can offer. For patients, game-based therapy is making a significant impact. From managing conditions like depression, anxiety, ADHD, and dementia to aiding in stroke rehabilitation, games are helping to improve motor skills, memory, and cognitive function. Active viral reality games also promote physical activity and emotional regulation, making treatment more engaging and effective. In short, games are proving to be a versatile and innovative tool that enhances both clinical precision and patient recovery. Game-based learning isn't just a trend, it's rapidly becoming a classroom staple. In surprising studies, 98% of teachers reported using math games weekly, and 75% now regularly include games in their lessons, showing widespread adoption across grade levels. Even more compelling, K-5 classrooms have seen a significant reduction in anxiety, anger, and negative emotions when educational games are used consistently, highlighting not just academic but powerful emotional benefits as well. Educational games are making unexpected breakthroughs in healthcare. VR training is shown to be 230% more effective than traditional methods in preparing medical professionals. For patients, games are being used to trigger dopamine release, easing conditions like anxiety and depression. Surprisingly, cancer patients are sharpening their memory and focus through gameplay before and after treatment, while individuals with ADHD, Alzheimer's, and dementia are using games to actively exercise reasoning and memory skills, redefining how we view therapy and rehabilitation.